So I did my presentation on the effects of manipulation for treatment on infantile muscular torticollis. Torticollis is the third major congenital malformation of the locomotor system found in newborns. It's a spindle-shaped rigid lump that's not really going to have any type of tenderness to it, primarily found in the middle and inferior segments of the SCM. Newborns that are 1 to 3 weeks of age are usually going to have this. They will have some fibrotic contractures, which can lead to head and neck tilting toward that affected side. There is a morbidity rate from 0.3% to 1.9%. Also, the obstructive venous return is what's the primary cause of muscular torticollis. So there's different ways that you can treat this. You can do non-surgical, surgical, and you can go to therapy to fix this. So for non-surgical treatments, this is mainly for kids that are less than 12 months of age. It's really recommended because the muscle's going to drag and enhance that healing rate of a non-surgery treatment. For surgery, children that are older than 12 months of age, it's recommended to do this, but however, post-op, the collapsed SCM on that affected side can cause some neck asymmetry and lead to any aesthetic compromises down the road. Or there's manipulation, which my study did using a conventional tweener manipulation versus a PMTM-OF, which I will talk about in the next slide. So PMTM-OF, it's a primary massage of twinning manipulation with one finger. So this is going to involve a small contact area, provide faster frequency and strong penetrating forces. It can produce better effects in promoting that blood flow, removing blood stasis, tissue regeneration, decreasing swelling, and alleviating some pain as well. It's used by using the tip of the thumb and goes in the vertical direction of the muscle fibers of the SCM. Or there's a tweener massage. So this was done in China, and they use this pretty often. But this is activating that blood circulation, relieving some swelling, disintegrating any type of mass that's there as well. And the thumb surface is used and then goes into a lifting and pinching method using the index finger along with the thumb. For my case study, they did a randomized controlled single-blind method. The Lindsay District People's Hospital is the one that did this on 500 infants that were diagnosed with the torticollis. And they split up into two groups, treatment and control. The treatment was the PMTM-OF and control was the tweener. And they did on patients that ranged from 8 to 180 days old. You can see in the chart below, they split it up so the treatment had 265 patients. The control had 235, and then they split it in gender, also the way the patient was delivered to, their lump type, right and left sides, and then how severe their torticollis was. Also, after 4 treatment courses, the SCM muscle was measured in size, and it was detected by using a 2-dimensional ultrasonography. It also checked blood flow using a colored Doppler ultrasonography, and then they checked the range of motion of the head and neck to determine their total curative effects. For the treatment group, the patient was in supine, and then the physician was on the affected side of the infant. They slightly rotated that head and neck to really expose the SCM on the affected side. The manipulation involved the tip of the thumb going in that direction that was vertical to the muscle fiber. Massage was performed in 3 segments, upper, middle, and lower. The upper segment was massaged for 5 minutes, the middle for 10, and then the inferior for 5, giving a total of 20 minutes for that massage. So this massage was done once a day for 30 minutes, and each over a 15-day treatment course. For the control group, the infant was placed in a lateral position with the affected side facing upward. For both groups, they did use a lotion to really help reduce some of that friction as well for when they did the manipulation. The SCM was massaged using the thumb surface for 6 minutes. The muscle was lifted and pinched using the thumb and index finger for 5 minutes. And then for the extension toward the intact side was performed using a gentle to heavy manipulation of the SCM. For this massage, it was done once a day for 20 minutes over a 15-day treatment course. So you can see how the treatment group could already have a head start over the control group because that had a 30-minute massage instead of the 20-minute massage. For the results, they split it up into 4 groups. So they had cured, very effective, effective, and ineffective. So for the treatment group, for cured, 55 patients were completely cured, that torticollis disappeared, and that 2-dimensional ultrasonography showed a reduction of the SCM, whereas the control, they found only 15 that were cured. For the very effective, you had 120 patients for treatment and 60 for control. So the deflection was almost gone, and then the ultrasonography showed still like a 50% reduction. For effective, you had 75 in treatment and control 125 patients. So the deflection was still alleviated, and then the ultrasonography showed a 25% reduction of that SCM. And then for the ineffective group, for treatment, they found 15 patients ineffective and control 35 were ineffective. So the SCM was not improved, and it was less than 25% of any type of result. So how would this benefit our patients, and also how can we promote this back to therapy? So if you're really working with pediatrics, I think this can be extremely beneficial, mainly because it's really going to help get them to reduce that torticollis so it's not so intense as a child gets older. But I found more cons than I did pros to this study. They did have also a very good number of people for this, which I thought was great. But for cons, it wasn't done on older adults, so we have no idea if this could be very beneficial to them or not. Also, I couldn't see myself massaging someone for 30 minutes just by using my thumb. So that's poor body mechanics. It's not something that we can really put any type of like our lower body effort into. You're just using a thumb pad for 30 minutes. So I think overall we could maybe take from the techniques and try to do some of that pinching and pulling, or just doing an upper fiber, a middle fiber, and a lower fiber, but not necessarily for 30 to 20 minutes, because that's just really hard for a therapist, and then trying to do that day in and day out can cause us to have more injuries than the patient in the long run. Also, would I want to do this on a child for that long? Probably not, because they'll probably start to feel uncomfortable, kicking and screaming. But overall, I think we can relate this back to any patient that has torticollis to start to use those different types of manipulations. I think that could be very beneficial, but doing it for that long of a time, and also it hasn't done on the older adult population, I'm not too sure how that would go. This is the end of my presentation. Thank you guys for watching, and have a great day.